Well, what I'm here to do today is to talk about the National Cancer Survey programme which we run at Quality Health for the Department of Health. We run the big National Cancer Patient Experience Survey covering about 114,000 people each year. We also run cancer survivorship, early symptom surveys, and radiotherapy and chemotherapy surveys and a lot of other things, and we've been doing that for 25 years, and I'm here today at the conference to talk about that and the benefit of asking patients about the care pathways they're on, about the care they've had and about the kind of treatment they've had and how that supports the intentions of the research community and the policy community within the NHS. We've been asking them, for example, about their early symptoms, the first thing they noticed when they indeed before they were diagnosed with cancer. In the early symptoms survey, we've been asking people who've survived cancer experiences and treatment how that experience has been, what's happened, what their health status is, 1 year, 2 year, 3 year, 5 years on from the original diagnosis. And we've been asking people, interestingly, in every single NHS trust in England that provides cancer services, what their experience of care was, what kind of information they were given, whether they were given any, whether it was good, whether it wasn't, and asking them for comments about their care. And 130,000 written comments were actually received as a consequence of this, and we got nearly 72,000 responses to the survey. So this is big stuff, and everybody else in the world is desperate to get their hands on this database. Well, what we found, first of all, and we've done 2 of the big national cancer surveys, is that services have improved considerably since 2010. We've found that 98 of the 160 trusts in England actually improved their services significantly. We found that over 80% of trusts improved overall. Very few had fallen back. And those improvements were spread right across the board, from information giving, information on free prescriptions, information on financial support, information on the kind of treatment and cancers they unfortunately had, and also better ratings for certain aspects of care. So the existence of the survey itself seems to have generated activity, interest to make services better. Essentially, we have found, as far as the early symptoms survey is concerned, that there are very, very clear patterns. We looked at 22 different tumour groups, and we found very consistent patterns across those tumour groups about what people noticed first off, or indeed if they noticed anything at all in some cases, because there are some cancers there are no symptoms. We also have been looking in the 2011 cancer survivorship pilot at 4 tumour groups: NHL, breast, prostate and colorectal. We've looked at the way in which those people's health status changed over that period of time, whether the perceptions 5 years out were different from 1 year out, and so on and so on. And we're also running right now the big radiotherapy patient experience survey, and we've also just completed the radiotherapy and imaging access surveys for NCAT and the department, looking at whether people would be willing to go to radiotherapy centres, for example, in the evenings at weekends and on bank holidays, and the overwhelming answer is yes, they would. So we're finding lots of really interesting stuff arising from this, which I hope will be of great benefit to clinicians and managers in the NHS and elsewhere. First of all, we want people to get better information and for people to calibrate their information according to the sorts of patients they're actually talking to. I mean, we found in the big cancer patient experience survey, for example, that certain kinds of people were more critical of care than were others. For example, women are always more critical than men in every NHS survey that's ever been done. Young people are more critical than older people, and so on and so on and so on. And therefore, when frontline clinicians like CNSs and doctors are actually talking to patients, it's important that they look at these findings to calibrate their communication with patients accordingly.